Cancer is a complex disease that can manifest in various ways. When diagnosed, one of the first steps doctors take is to determine the stage of the cancer. Cancer staging is a crucial process that helps doctors understand the extent of the disease within a patient's body. It provides valuable information about the size and location of the tumor, whether it has spread to nearby lymph nodes, and if it is metastasized, meaning spread to distant organs. Staging is not a one-size-fits-all approach. Different types of cancer have specific staging systems. However, most systems use a combination of letters and numbers to represent the stage. Understanding cancer staging is essential for both patients and their families. It helps them comprehend the seriousness of the diagnosis, anticipate potential challenges, and make informed decisions about treatment options. Knowing the stage of cancer empowers patients to have more informed discussions with their healthcare providers. They can ask relevant questions, understand the rationale behind treatment recommendations, and actively participate in their care plan. In essence, cancer staging provides a roadmap for doctors and patients. It guides treatment decisions, helps predict prognosis, and allows for better communication and shared decision-making. The TNM system is the most widely used staging system for many types of cancer. TNM stands for tumor, node, and metastasis, each representing a key aspect of the cancer's progression. The TNM system provides a standardized framework for doctors worldwide to communicate and share information about a patient's cancer. The T in TNM refers to the size and extent of the primary tumor. It is categorized using numbers from 1 to 4, with higher numbers indicating a larger tumor, or one that has grown more deeply into nearby tissues. For instance, a T1 tumor is typically small and localized, while a T4 tumor is larger and may have invaded surrounding structures. The N in TNM stands for lymph nodes, which are small, bean-shaped organs that filter out harmful substances from the body. Cancer cells can sometimes break away from the primary tumor and travel through the lymphatic system to nearby lymph nodes. The N category assesses the involvement of lymph nodes, with N0 indicating no lymph node involvement and higher numbers, N1, N2, N3, indicating increasing levels of lymph node involvement. M in TNM stands for metastasis, which refers to the spread of cancer cells from the primary tumor to distant organs or tissues in the body. M0 signifies that cancer has not spread to distant sites, while M1 indicates that metastasis has occurred. The presence of distant metastases has. Once the TNM categories are determined, they are combined to assign an overall stage to the cancer. The stage is represented by Roman numerals from 0 to 4, with stage 0 being the earliest and stage 4 the most advanced. Stage 0, also known as carcinoma in situ, indicates that the cancer is in a very early stage and is confined to the layer of cells where it originated. Stage 1 cancers are generally localized and have not spread to lymph nodes or distant organs. Stages 2 and 3 typically involve larger tumors that may have spread to nearby lymph nodes. The higher the stage within this range, the more extensive the lymph node involvement. Stage 4 cancers have metastasized, meaning that cancer cells have spread from the primary tumor to distant organs or tissues. This stage is the most advanced and challenging to treat. It's important to note that cancer staging is not a static classification. As the cancer progresses or responds to treatment, the stage may be adjusted to reflect the current state of the disease. Section 4. The importance of staging in treatment. Cancer staging is not merely a way to classify the disease. It is a crucial tool that guides treatment decisions and helps predict the likely course of the disease, known as prognosis. The stage of cancer provides valuable information about the aggressiveness of the tumor, its potential to spread, and the patient's overall health. This information helps oncologists determine the most appropriate treatment approach and develop a personalized care plan. For instance, early-stage cancers, stages 0, 1, and some stage 2, may be treated with local therapies such as surgery or radiation therapy, which aim to remove or destroy the tumor while minimizing damage to surrounding healthy tissues. Advanced stage cancers, stages 3 and 4, often require more aggressive treatments such as chemotherapy, immunotherapy, or targeted therapy, which work systemically to kill or inhibit cancer cells throughout the body. Staging also plays a vital role in predicting a patient's prognosis, which refers to the likely outcome or course of the disease. Early-stage cancers generally have a more favorable prognosis compared to advanced stage cancers. The 5-year survival rate, a commonly used metric in cancer statistics, represents the percentage of patients who are alive 5 years after their initial cancer diagnosis. While this statistic provides valuable insights into long-term outcomes, it's important to remember that each patient's journey is unique, and survival rates are influenced by a multitude of factors. Section 5. Treatment options based on staging. Treatment for cancer is highly individualized and tailored to each patient's specific needs and circumstances. The stage of the cancer is one of the most critical factors that oncologists consider when developing a treatment plan. Other factors include the type and location of the cancer, the patient's overall health, and their personal preferences. Surgery is often the primary treatment for early-stage cancers that are localized and have not spread to nearby lymph nodes or distant organs. The goal of surgery is to remove the entire tumor along with a margin of healthy tissue to ensure that all cancerous cells are eradicated. Radiation therapy uses high-energy rays to kill cancer cells or stop them from growing and dividing. It can be delivered externally using a machine outside the body or internally using radioactive implants placed near the tumor. Radiation therapy is often used in conjunction with surgery or chemotherapy, depending on the stage and type of cancer. Chemotherapy involves the use of drugs to kill cancer cells or prevent them from multiplying. It is a systemic treatment, meaning that the drugs travel throughout the body to reach cancer cells wherever they may be. Chemotherapy is often used to treat advanced stage cancers that have spread to distant organs or lymph nodes. Targeted therapy is a newer type of cancer treatment that focuses on specific molecules involved in cancer cell growth and survival. These therapies are designed to block the action of these molecules, thereby inhibiting cancer cell proliferation and promoting cell death. Targeted therapies are often used in combination with other treatments, such as chemotherapy or immunotherapy. Section 6. Living with cancer. Follow-up and clinical trials. After completing cancer treatment, patients enter a crucial phase called follow-up care. Follow-up care is essential for monitoring the patient's recovery, detecting any signs of recurrence, and managing long-term side effects of treatment. During follow-up appointments, oncologists will typically perform physical exams, order blood tests, and may recommend imaging scans to assess the patient's health and check for any signs of cancer recurrence. Clinical trials are research studies that involve human volunteers and play a vital role in advancing cancer treatment and care. These trials test new drugs, treatment combinations, or other interventions to evaluate their safety and effectiveness. Patients who participate in clinical trials have access to cutting-edge treatments and contribute to scientific knowledge that can benefit future patients. Throughout the cancer journey, open communication between patients and their healthcare providers is paramount. Patients should feel empowered to ask questions, express their concerns, and actively participate in decisions about their care. Support groups, counseling services, and online resources can provide valuable emotional support, practical advice, and a sense of community for patients and their loved ones.